Hello and welcome back to this series of how to become an occupational health physician or a company doctor. The next question for us to continue was about salaries. So how much would you expect to get paid? Well, again, this depends on many factors. I'll give you some examples. Let's say, for example, in the United States, based on my research, it may range from somewhere between $8,000 to $15,000 per month. That's in the United States. It could be higher, though, depending on the years of experience or different allowances that you take. For example, if you're deployed in a remote location, things of that sort. For example, in the United Arab Emirates or in the UAE, it may range from 18,000 to 85,000 dirhams per month. Again, it's a big range from 18 to 85,000, but that's how the range could be. In most of the developing countries, the low and middle income countries, like the countries that I used to serve in, well, you'd usually be very low, so don't have high expectations. You'd range somewhere between, let's say, $1,800 to $1,500 or $2,000. That may be the maximum that you would expect. It's not common. Somewhere between $800 and $1,000, $1,500 per month. It depends again on things like where are you located, etc. So this is about the pay. Promotion chances. Oh, this is a very important thing. If you are working as a company doctor, you have to understand that you are support staff. You are not in their core hierarchy. So there is not many chances for you to be promoted. What are you going to become? I mean, let's say, for example, the best case scenario, like there are many doctors in different sites, and then there is one country manager. So how are you going to be promoted there? It's there is a challenge. Usually, this is what many doctors, I did the same, you would shift somehow into becoming a part of their occupational health and safety team and specialists, and this is one of the most common ways for you to be promoted, because you can become now quality health safety or health and safety manager or supervisor, and then you can become the safety country manager, and then you can become, so this is a way to be promoted. But usually if you're just the company doctor, most probably you will stay as a company doctor. So again, check the hierarchy in the company that you're going to work with. Very important thing to discuss is the link with safety. You cannot, this is the most important skill that you need to learn. You cannot separate occupational health from occupational safety. You'll be dealing a lot with standards that are not related really to health or hospitals, as much as you're going to be dealing with standards like ISO 45001, for example, for occupational health and safety management. You'll be dealing with laws related to the Department of Labor more than the Department of Health or the Ministry of Health. So you'll have that balance, and you need to understand, and I would have to say you will have to study safety. So you check what is the the most prominent safety training or occupational health and safety certificates, because it's the one thing. Because whatever we do in safety, we're doing to protect the health of the people, whether from sickness or disease or from being injured. As an occupational health doctor, and many company doctors would agree with me, there is not really a lot of medicine or treatment that we can give you. Usually our first reaction, the best thing to do, is to remove someone from exposure. Our work is mainly on, yes, there is of course therapy, there is chelation therapy, stuff like that, but in the end, if someone gets sick, they're sick, and we will transfer them to the specialty of that sickness. If their chest having a problem, we'll transfer them to that specialty. If they have something with their musculoskeletal disorders, we'll send them to that kind of specialty. But at work, we are mainly about prevention. Right? So this is what we need to focus on. This is where safety comes in. The next question is, what are the most common complaints? And I leave this question to our last video of this series in order to keep the videos short. So thank you. I'll see you in the next video.